With summer just around the corner, it's time to clear some misconceptions about cancer. Hi there, I'm Dr. Julio, attending physician here at the Oasis of Hope. Let's separate the fact from the fiction and keep your skin safe all season long. Let's get started. Only fair-skinned people get skin cancer. It's not true that only fair-skinned people get cancer. Skin cancer can happen in all kinds of patients with all kinds of skin color, but the risk of having skin cancer is higher in patients with fair skin. Actually, patients with darker skin are more related to having higher complications from skin cancer because the screening and the protection from skin cancer is lesser if you have darker skin. Normally, you're not prepared or worried about having skin cancer if you have darker skins. Besides that, melanin protects the body from skin cancer. But no matter your skin color, you have to protect yourself from skin cancer and get checked whenever you feel it's necessary. You can get sunburn or develop skin cancers on cloudy days. Yes, it is possible to develop skin cancer even on cloudy days. Actually, there is a measurement of UV radiation which can pass through the clouds and affect you. Some people with fair skin can get sunburn even if it's cloudy outside. So it's always important to measure the amount of UV lighting in your area before going outside. And it's recommended to wear sunscreen even if it's going to be cloudy outside. Actually, when I was in medical school, my dermatologist was giving me the dermatology class, recommended me to wear sunscreen even inside the rooms, inside the hospital, especially because of the strong UV lights that we use all the time here. So please, always check the UV index, and even on overcast days, wear your sunscreen protection all the time. Skin cancer, it's not a serious disease. Oh. Skin cancer is indeed considered a very serious disease, especially melanomas. Melanomas account to 2% of all skin cancers, but melanomas are responsible for up to 80% of skin cancer-related deaths. The incidence of melanoma is increasing, and it's always a very serious disease. Non-melanomas skin cancers, which are basal cell carcinomas and squamous cell carcinomas, also pose a significant morbidity, but the amount of deaths related to these cancers is way lower than the melanomas. Skin cancer always appears as a dark mole. Skin cancer doesn't always appear as a dark mole. Melanomas, the most dangerous type of cancer, normally appears as a dark mole, but there's different variables of melanomas. We normally utilize something called A, B, C, D, E in order to evaluate the risk of a skin lesion being a melanoma. A means asymmetry. Normally, a normal skin lesion is symmetric. B stands for borders. Normally, all the borders of a normal skin lesions are stable or the same. They don't have any changes in color. The C stands for color. Normally, lesions have the same color all over, healthy lesions, and melanomas have different colors. It can vary from red to blue to white or to brown. D stands for diameter. Normal lesion on the skin, a healthy lesion on the skin, has to measure less than 1/4 of an inch. And the E stands for evolution. Normally, a lesion on the skin, a healthy mole, doesn't change over time. If you have a lesion that tends to bleed or to changes all the time, sometimes desquamates, you have to get checked with your dermatologist to see if it's related to a melanoma. Other types of skin cancer, just such as squamous cell carcinomas and basal cell carcinomas, can represent a different kind of lesion, sometimes a bleeding lesion, sometimes areas that are translucent or pearly. Skin cancers only affect older individuals. Although older adults are more prone to having skin cancers don't have respect for any age, especially on the current time where we are using tanning beds and when we are exposed to different amounts of radiations all the time. Cancer can appear in younger and younger populations, especially squamous cell carcinomas and basal cell carcinomas. Additionally, immunosuppression, for example, patients with organ transplants are more prone to having all kinds of skin cancers and other cancers. Skin cancer can affect anyone. Myths such as the ones that I told you about in regards to your skin color or the presence of cloudy days or any other situations don't disregard you from having cancer. And it actually can delay the diagnosis and increase the risk of having a more aggressive form of cancer. So please get screened with your local doctor. Thank you so much for watching. If you have any questions, please drop them below in the comment section. I'll be happy to help you. Oasis of Hope is an integrative hospital caring for the mind, body, and spirit, and we'll be happy to help you if you have any questions.